As promised, Dr. Kevin Kavanagh, retired physician, also founder of a national organization called Health Watch USA, joins us now. Good morning, sir.
Good morning, Jack.
How was your Thanksgiving?
It was very good. Very good.
Good. Well, we're glad to hear it. This morning we have a new concern that's happened between now and the last time we spoke with you, and that is that new variant out of South Africa. What can you tell us about it?
Well, that's correct. It's very concerning. We don't have a lot of data that really tells us the exact behavior of this virus, but it looks like it very successfully competes with Delta, and it is spreading extremely fast. And of course, I think people have heard on the news reports how this is now popping up all over the world. And so far in the United States, we don't have confirmed cases, but it is suspected that, similar to other countries, we may have a few individuals here that have the Omicron variant. And of course, if you've traveled from abroad, you really should be self-quarantining and being extremely careful. In South Africa, this variant appears to have arisen from I believe it's pronounced Gauteng Province. This is one of 9 provinces in South Africa. It has a population of over 12 million. And in the last 2 weeks, hospitalizations have tripled in that province. And this is how come they've identified this virus. Now, I should add that there's only about 25% of the entire population of South Africa that's fully vaccinated. They have fallen behind in vaccines, according to Pfizer. Scott Gottlieb from Pfizer, he's on the board of directors. He was on Face the Nation stating that South Africa is having problems with distribution of the vaccine, that they have somewhere around 30 million doses and only 19 million administered. So we've got a problem of getting third world countries and the entire world vaccinated. And this is not only in vaccine being shipped to the countries, but also setting up a distribution network. And unfortunately, this virus is mutating faster than vaccines can be made. As you know, some people have declared herd immunity during each of the troughs between the peaks, and that hasn't worked out. A lot of people, including individuals on FDA committees, were questioning Pfizer of why not get a vaccine out for the Delta variant. And Pfizer's response was, well, I think we should hold. We still have coverage on our original vaccine. There may be a variant that escapes immunity. And that variant, they are worried, is the Omicron variant. It has 30 plus mutations on its spike protein. So already now the vaccine makers are reformulating the vaccine for this variant, but it will take them probably 1 or 2 months to get that reformulation made. And then, of course, you have the manufacturing and distribution process, and we have a tremendous amount of vaccine hesitancy in our population. What I'm very worried about is our healthcare system, our frontline healthcare workers, if they're going to be able to withstand another surge. And the best way we can help them is to get vaccinated. And if you are vaccinated, get a booster. If you've had a past COVID infection, get vaccinated, because in both of those categories, you have a tremendous increase in immunological response. A new paper out shows that increases between 25 to 30 times the amount of antibodies produced if you just went with a natural infection or a 2-dose vaccine. And so it is of utmost importance, because it is felt that you will get a degree of protection from a booster meaning either a vaccine dose after a 2-dose vaccine or getting vaccinated after a natural infection.
And as far as this Omicron, however you want to pronounce it, is concerned, over the weekend I paid pretty close attention online and on TV and radio as to the reports, and I've heard everything from typical overreaction by Americans to Dr. Fauci's approach, which I found to be cautious but not pushing any panic buttons, to people that are pushing panic buttons. And what has happened, and we're going to have Quint Tatro from Jewel Financial on with us in a few minutes, is the markets all over the world are responding in a bad way to this news. So at this point, I kind of go with the Fauci approach, and that is let's be very, very cautious and keep a close eye on this thing. Let's don't sell the farm yet. Let's don't panic. Let's just be very, very cautious and see where this thing goes. Do you agree with that?
Absolutely, because what is not known is the case fatality rate or the lethality of this virus. For example, in South Africa, it could be just those who are unvaccinated, which is 75% of the population, are filling up the hospitals. So we have a good out here. And I should add that travel bans, these occurred during the Trump administration, they're occurring now during the Biden administration, are a good idea. We are not able to mandate vaccinations on airplanes or air travelers coming in, or at least appears that we're not able to mandate that, nor do we have set up a system of quarantining these individuals, similar to what Australia is doing. So as a short-term measure, travel bans will buy us time. They won't stop the spread of the virus, but they will slow it down and buy us time because as a last resort, the Pfizer drug appears to be very good, very efficacious, but Pfizer needs time to gear up manufacturing and distribution of this drug. And we're talking about weeks here. So if you delay the spread of the virus by 2 to 3 weeks, you will be saving lives. So I think the travel bans were good in the Trump administration. It bought time.
Yep.
They're good in this administration.
I agree. I appreciate it very much. We'll talk to you on Friday.
Thank you, Jack.
Dr. Kevin Kavanagh.